Hello and welcome to today's webinar. Thank you all for joining us. I am Jenny Kite, Senior Stakeholder Engagement Manager at Astellas, leading engagement with advocacy partners to develop long-term mutually beneficial relationships, as well as overseeing internal and external advocacy communications. As part of this role, I also manage ChangeTogether.com, guiding content strategy and working with advocacy groups to share their stories through the website. Astellas and Change Together marked this year's Bladder Health Month with a month-long program of articles to raise awareness and improve education around bladder-related conditions. These articles have been co-created with representatives from the advocacy community, including Jessica Bateman from Urology Care Foundation, the Foundation for the American Urological Association, Phyllis Greenberger from HealthyWomen, and Steven Gregg from the National Association for Continence. We are concluding this month's activities with today's webinar entitled Driving Positive Change for Patients Through Collaboration and Education, with the article contributors forming the expert panel. We'll be hearing from each in turn as they share perspectives on collaborating to promote patient care, collaborating to safeguard women's health, and how to involve social media into your activities. During the webinar, you can put your questions to the panel using the BrightTalk system. You will see a box under the slide where you can type these in. We are going to have around 30 minutes of presentation, and then we'll be answering questions. If you don't get to your question during the webinar today, then we will follow up after the event. Before I hand over to the first speaker, I'd like to kick things off by asking you a question to get you involved. The question is on the screen. What does patient advocacy mean to you? If you could please put your answer in the box where it says to put your question. So again, put your answer in the box where it says to put your question. We'll take a look at your responses and make sure we cover off on that during the discussion part of this webinar. Now, I'm pleased to introduce our first speaker, Jessica Bateman. She is the Patient and Research Advocacy Manager for the Urology Care Foundation. In this role, she has responsibility for ensuring the patient voice is incorporated into legislative initiatives and the policy agenda. Jessica provides outreach and resources to patient, physician, and veteran organizations that complement the AUA's advocacy efforts. Additionally, she leads and participates in patient-focused coalitions that increase awareness about health disparities and enhance patient access to care. Jessica, I'll turn it over to you now to walk us through your slides. Thank you.
Okay, great. Thanks, Jenny. Good afternoon, everyone. Happy to present and be with you today. So as Jenny said, I'm the Patient and Research Advocacy Manager for the Urology Care Foundation. And specifically, my role at the foundation is to incorporate the patient perspective into our advocacy initiatives and strengthen the foundation's legislative messaging by partnering with those who have aligning advocacy agendas. And as background, the Urology Care Foundation is the world's leading nonprofit for urological health and is the official foundation of the American Urological Association. So we partner with physicians, researchers, healthcare professionals, patients, caregivers, families, and the public to support and improve the prevention, detection, and treatment of urological diseases through research and education. My work with the foundation entails, as I mentioned, working with urologic advocacy partners who aim to raise awareness about urologic conditions and provide resources that help improve the lives of patients. One of the key activities led by the Urology Care Foundation is the Bladder Health Alliance. This alliance was established in 2013, an effort to bring together a group of patient advocates who were working separately at the time to advocate for patients with bladder health conditions. Since its inception in 2013, the Alliance has continued to grow and evolve and primarily focuses on raising awareness about conditions impacting bladder health and encouraging dialogue between patients and physicians. Currently, there are 34 patient and physician advocacy groups who participate in the Bladder Health Alliance, and you can see most of their logos listed on the screen here. In addition to raising awareness and promoting patient and physician dialogue, the group decided in 2016 that the best way to raise awareness about bladder health conditions was to officially declare November as Bladder Health Month. There were several mechanisms the group explored to make this declaration. By mobilizing grassroots advocacy efforts that included letter writing campaigns, visits to Capitol Hill, and organized social media efforts, the group successfully declared November as Bladder Health Month, and it's nationally recognized on healthfinder.gov. Additionally, collective advocacy initiatives resulted in passing a House resolution that was introduced by Representative Eliot Engel, and a Senate measure was introduced by Senator Mark Kirk, which recognized November as Bladder Health Month. In addition to the work on the federal level, we also did a lot of work at the state level to introduce state proclamations and resolutions. The picture shown here is from our most recent meeting on October 5th, where members of the Bladder Health Alliance met to discuss plans for promoting Bladder Health Month in November. I mentioned that there were more than 30 organizations who comprised the Bladder Health Alliance. These organizations represent patients living with many conditions, including bladder cancer, interstitial cystitis, overactive and underactive bladder, neurogenic bladder, incontinence, nocturia, bedwetting, UTIs. The tagline for our 2017 Bladder Health Month campaign was to get the facts about conditions impacting bladder health. Collectively, we know that tens of millions of Americans suffer from a variety of conditions that impact bladder health, and these diseases impact health and quality of life and result in significant problems and barriers to patients, and they're also estimated to cost more than $70 billion each year. So our goal is to raise awareness about these conditions and encourage individuals to get the facts so they can talk to their healthcare provider about direct, positive, and healthy ways to actively manage their bladder health. Cumulatively, we know that these conditions impact many aspects of a patient's life. And as part of our Bladder Health Month campaign, the Urology Care Foundation developed 2 resource pages. One page was specifically for patients and one specifically for providers that's shown here on the page. The physician page focuses on how to initiate conversations about bladder health. The provider page can be found at auanet.org and features themed resources and materials such as videos to help providers start a conversation with their patients, posters they can hang in their office, social media ideas, and it also includes links to materials that physicians can download or order at no charge to them. In 2016 and 2017, the group promoted Bladder Health Month through dividing the month into weekly themes and highlighting targeted conditions each week throughout the month. In addition to the weekly themes and resource pages that I just showed you, the group launched the 2017 campaign with a thunderclap, which had more than 50 advocates sign up to simultaneously post a message about Bladder Health Month on their social media pages. Collectively, this message was seen by over 135,000 individuals. So moving forward into 2018, the Bladder Health Alliance aims to focus efforts on the need to sustain and increase funding for medical and behavioral research to better understand and maintain bladder health and to treat bladder health conditions. We know funding is critical to move the needle, and that's a common goal for all of our Bladder Health Alliance members. And also to effectively highlight how these conditions impact bladder health, the group is working to collect and feature patient stories that illustrate how conditions impacting bladder health affect quality of life of patients. And that's all that I had to share today.
Thank you so much, Jessica. If you have questions for Jessica, please go ahead and add those to the questions section on the right of your screen. After we hear from Phyllis and Steve, we will be opening up to a Q&A discussion, and so certainly put those in there right now. Thank you. Phyllis is our next speaker. Phyllis Greenberger is the Senior Vice President for Health Science and Health Policy for HealthyWomen. She directs HealthyWomen's effort to publicize and support health policy that improves women's lives and raise awareness among women about how policy affects their health. Phyllis leads HealthyWomen's focus on raising awareness for inclusion of women and minorities in clinical trials and support for considering sex as a biological variable in research studies. From 1990 through 2016, Phyllis was the president and CEO of the Society for Women's Health Research. Phyllis, I'll turn it over to you for your slides as well.
Okay, thank you so much. I'm delighted to be part of this conversation. I just want to say that we're having trouble advancing the slides on the screen, so I don't know if you can advance them. We're working on that. But in the meantime, I guess the difference, HealthyWomen is America's leading independent nonprofit health information source for women. And our mission is to educate and empower women to make informed health choices for themselves and their families. Up until 2016, we were primarily an education and communications website, or mostly virtual, and really bringing information that all women need for themselves and, of course, indirectly for their families to keep them healthy and give them the information, the latest information on various conditions. It became apparent, certainly even more apparent now, that we needed to get involved in policy and advocacy. And so we expanded our focus into those areas. And it's clear, as Jessica said, that policy affects women's health, and that particularly, as I said, at a time like this, it's really crucial. One of the major programs that we did, which I'll talk a little bit later, is about the Affordable Care Act. So it's clear, certainly the conversations on the Hill now make it very clear that women need to be aware of the legislative developments that can directly impact their health and their lives. So as Jessica said also, as in her presentation working with other groups, ours is the same. The difference being is while they are focused on a particular area, we're focused on really all of women's health. And so we have a very large network. We work, of course, with industry on issues that are affecting us both in certain areas. Obviously, with other advocacy groups, so we work with all the women's groups, a lot of the disease groups individually, since we do focus on a number of diseases, and we always try to include those organizations that are focused primarily on them. And we do, and we will be doing some work on the state level on opiates and medication-assisted treatment. And that'll also be new for us, working on some of the state issues. And we think we are successful for a lot of reasons. We have a great network, and we have a huge number of women that come to our website. And we work with many, as I said, many of the groups, as well as some of the minority organizations like the Black Women's Health Imperative and the Hispanic organizations. And so we really try to include everybody. We do a number of things in addition to the website. We have held breakfast recently, a breakfast briefing with Marsha Henderson, the head of the Office of Women's Health at the FDA, to talk about what they are doing on women's health. We're planning to have additional ones. We are planning, in the planning stage now, to hold some research and innovation events looking specifically at sex differences. While sex differences has been recently accepted as a reality, there is still much work to be done in that area. A lot of issues that really haven't been looked at, and also the whole area of medication and what medications work differently for women than men, if that's part of the issue. So we are going to be looking at sex differences and bringing experts together in order to start that dialogue. And then, of course, we would be issuing a paper, and depending upon what comes out of the roundtables, we would develop some policy and advocacy outreach. As I mentioned earlier, one of the primary policy focuses, I think is not surprising, has been the Affordable Care Act. We started a campaign several months ago, it's sort of blurred at this point, to make women and their health care providers aware of the threats to the 26 preventative services protected by the Affordable Care Act. We held a briefing in Congress, which was standing room only. It was very well attended, and then we proceeded to hold a media event in New York City, also very well attended for the media. And then we've done a number of blogs, both on the Huffington Post and the HealthyWomen's website. Of course, the blogs keep changing depending upon what's going up on the Hill. But we did one against the Cassidy Graham bill. We've done one, as I mentioned, to keep the care in terms of the 26 preventative care. We also did one to keep coverage for contraception. And most recently, we did one on keeping the deduction for medical expenses. And we are planning, we'll be doing another one shortly. I have one actually on Alzheimer's disease that's going to be coming out shortly, and then we are doing one on opiates that hasn't been published yet. So we have about 7,000 to 8,000 visitors, 700,000 to 800,000 visitors a month. We do a lot of social media, obviously the typical ones, Twitter, Facebook, etc. And we try, obviously, to get our message out and hopefully sort of stir interest in our audience to contact their members of Congress on these particular issues. And then, so this has been an interesting year, obviously. There's been a lot of policy issues to address, and we are going to keep addressing them. And we hope that all of you listening will be involved and help us make changes or keep things the way they are, depending upon what the issue is. Our blogs and our policy content are at www.healthywomen, that's one word, .org. I want to thank you for the opportunity to address you today.
Thank you so much, Phyllis. I appreciate your insights. And again, if you have questions for Phyllis or Jess, please enter those into the questions section to the right of your screen, and we'll be sure to answer those after we hear from Steve Gregg. So Steve is the Executive Director of the National Association for Continence. Dr. Gregg leads the organization in its efforts to educate patients on the causes, prevention, diagnosis, treatments, and management alternatives for incontinence. Prior to joining NAFC, Gregg led marketing and communications initiatives within the pharmaceutical, healthcare, consumer packaged goods, and technology industries. His career has ranged from scientific investigation for a global sports beverage to global brand management for Fortune 100 companies. Steve is a graduate of the University of California at Berkeley, where he earned his PhD. Steve, I'll turn it over to you to provide some information on social media.
Thank you, Jenny. Good afternoon, and I'm so pleased to be here with you today. We at NAFC have been around since 1983. We were originally known as HIP, Helping Incontinent People. And our focus is almost exclusively and entirely related to bladder and bowel issues. Along with our strategic partners and healthcare providers, our focus is trying to get patients to understand what their options are and how to manage their care. On the slide in front of you, you see an image of our Facebook page. And I wanted to take a moment and talk to you a little bit about two things here. One is we learned very early on that even though we were in a medical condition with a awful stigma, that is, people don't want to talk about incontinence, we needed to be in a way that people could access us. So we focused on making sure that we were mobile ready, and about 55% of all of our traffic comes from smart devices, which is a little surprising because we thought iPads. But it's also, how do people access information that's educational off a smartphone versus the way you would think somebody would search it on a computer? The other thing we realized is that actually nobody in the world wants to follow an incontinence organization. And so they don't want incontinence in their RSS feed. And so we've rebranded our social platforms Be Health, which stand for Bladder and Bowel Health, and it's actually Better Health, Better Bladder and Bowel Health. Together, those make us a little bit more accessible for patients. When Jenny asked me to talk today, I was delighted, but it started me to think about the question, does social media work in this area, which is educational in nature, and yet is an area that has the stigma, which is about low levels of engagement. We all have heard numbers about how many folks are challenged by incontinence, and the numbers may be somewhere upwards of 60 million. But if you look at those that are actually seeking treatment, it is very, very low. So the question is, does social media work? And so we thought long and hard about this and said, well, you know, if it's done right, it probably does. The question is, do you know what you want your social media to do? And are you clear about the direction in which you're going? The second piece we found is that you really need to know your audience. And that is why we actually rebranded ourselves, because people just don't want to be following NAFC. And we found that social media has an immediacy, and so trial and error may produce results. And frankly, half the time we're shocked by our successes, and we are disappointed by things that don't go the way we plan, but the marketplace dictates how those work. So here's how we actually take an approach to actually all of our communication. One is we sit down and we develop an annual calendar of content. For example, we know that October we will be heavily invested in creating materials for November Bladder Health Awareness Month. But we also look at periods where we can find other areas of heightened interest where we might actually be more top of mind. Men's Health Month, Women's Health Month, Healthy Aging in September are examples of those. So we look for key moments where we might be able to find greater engagement. The other piece is we found that you need to have lots of friends. So organizations like yours and organizations like HealthyWomen and Jessica at AUA are good friends of ours. And the more friends we have, the more we can share. And we invite quid pro quo. If we do something for them, they're likely to do something for us. So we share content, we do things. We've also found out that nobody actually reads much anymore. So if you're not moving to video, you really need to start to look at how do you get patients to engage. Our website, which is full of content, is moving to something that's actually easier to sort through, easier to access, and easier to catalog. Facebook is an interesting animal, as many of you probably well know, and the rules change constantly, and we found that we have to pay to play. If you just are sending out posts to those that like you or follow you, the chances are you're only hitting about 10 to 20% of your audiences. We do periods where we will buy advertising from Facebook, pay for advertising space. I don't think in any week we've ever spent more than $150, but we'll be very close to that. And then finally, in our approach, we want to make sure that we're tracking and analyzing what works, which leads me to some examples. Here's some of the things that we learned, is that when you post things in places like Facebook, there's a variety of things that could be happening. And so to find out how your audience engaged with these or what they liked or how they shared them, you need to understand what they're looking at. You see some examples of ours that range from images that are very emotional, the pregnant lady on the right-hand side when we were speaking to her, to very educational, like the ones in the middle, to make sure that we're understanding how to deliver information in a way that our audience actually would really like that. We also really try very hard to invite engagement. We can do a whole bunch of things from surveys to posts, but by and large, we try to engage audiences with materials that are worthwhile. And what you see here are a couple of things that we've done. On the left-hand side is a campaign that we've been running through the year called Life Without Leaks. And you'll notice that most of these at the top are all shared by other organizations. Because we put time and effort into good quality content, the organizations that are very similar to ours or work in our space are likely to use them and share them with other folks. And we have supporters. So we do a number of programs where we actually try to help folks like physical therapists, doctors' offices, nurses, MPPAs, reach out and engage their audience in this very difficult conversation related to incontinence support, incontinence treatment options. And so we try to get them engaged. And here's one where we had an HCP challenge that uses our fact sheet. The response was great. People are, again, they're likely to use really good content, particularly if they can make some modifications on those pieces. And finally, here are some things that we've found out. While we don't necessarily think of ourselves in competition with organizations, if you look at what similar organizations are doing and what they're posting and how it's responding, you might learn nuances or trends that you would see in your audiences. We also, again, we spend some time experimenting with the types and objectives of audiences on our pay-for-play with Facebook. Now, we can be very targeted, but again, you've got to try different creatives and different pieces. And then finally, all platforms are not equal. While we use Twitter, we use Instagram to some degree, and Facebook, what works on Facebook does not necessarily work on Twitter. And so you have to be willing to think and experiment on both of those. And with that, I'll turn it back to Jenny, and I thank you for your time.
Thank you, Steve. I appreciate it. Now, remember, if you haven't already done so, please put your questions to the panel in the section to the right. You will see a box under the slide where you can type these in. If we don't get to those questions today, we will make sure to follow up with you individually. We'll also be doing a recap article on changetogether.com where you can where you'll see some additional information. So at the start of the webinar, we asked, what does patient advocacy mean to you? So let's take a look at some of the themes that came out of that from our audience. So certainly there's a focus on the patient, patient advocacy, there's a real focus on the patient, but to dive a little bit deeper, we want to make sure that we're ensuring their voice is heard. So I think you heard that from our panelists today, that patient advocacy is making sure that that voice is heard, that patients are provided access to care, and that the work that the advocacy community does supports R&D, research and development, to ultimately benefit the patient. And so those are some of the themes that we heard come through from your responses. So thank you for those that typed in your answers. I want to turn it over to the panelists and say, what are your thoughts? What are your thoughts on what patient advocacy is? Phyllis, could I ask you to start, and then we'll have Jess and Steve chime in as well?
I think people have to know, obviously we're focusing, Healthy Women focuses primarily on women, but all these issues can affect women and men, a number of them. Advocacy, what it means, I mean, if you don't have people advocating for certain things, it's not going to happen. I've spent my life advocating for women's health and advocating or trying to impress upon researchers and physicians and healthcare providers that in many cases women needs to be, that there are sometimes gender differences and sex differences in terms of how treatment is applied. And this, it took years to have this happen. It's still not a done deal, but it took a lot of work, a lot of advocacy, a lot of work with members of Congress, with the National Institutes of Health and with the Food and Drug Administration. And you can't do it alone. It needs to be a group voice, and you need to work together, and you have to be persistent. And so without advocacy, we wouldn't have the funding for women's health research, and we wouldn't have women in clinical trials, at least to some extent now. So advocacy ultimately is the beginning in order to provide health care to everyone when they need it, and obviously we're going to all need it at some time or other. So advocacy is very important, and has to be part of every organizations and disease organizations and women's health organizations and men's health.
Thank you. Yeah, you can't do it alone. That's for sure. Thank you. And Jess, could I get your thoughts on what patient advocacy means to you or means to the Urology Care Foundation and AUA?
Sure. I would have to say that it's raising your voice, and obviously if your voice is collectively with partners, I think that's a good thing. But raising your voice to enact change or to protect something that you find of value to you. So obviously there's a lot of different ways to go about your advocacy campaigns, and it's not a one-size-fits-all approach. I think, looking at who you're targeting and really strategizing about what the best way to meet your objectives is important. One thing about the Bladder Health Alliance is that it demonstrates that there really are power in numbers. So everybody coming together, specifically on our social media campaigns or, writing letters to Congress, it's really effective if people hear the same unified voice from multiple people.
Great, thank you. And Steve, do you have a few comments as well from your perspective on what patient advocacy means?
Sure. We address issues that those that don't have a voice need someone to stand up for them. So, for example, one of the projects we've been involved in since 2010 is creating performance standards for adult absorbent products, pull-ups and briefs. And the reason that we're involved in this is the state of South Carolina came to us and said, if we don't have performance standards, then Medicaid recipients will receive whatever product we can buy at the cheapest possible price. And we feel that those individuals, particularly there are no Medicaid waiver recipients anymore, they're just Medicaid patients. Those Medicaid patients need somebody to advocate on their behalf to make sure that they get the quality product that protects them and ensures to the degree possible a good quality of life. We also advocate on areas that are very important to our members, if you will, and that is access to care. We're very committed to working with the FDA to make sure the patient voice is heard and that physicians have the latest and best possible treatment options in this space for patients. As you know, incontinence is very difficult to diagnose. There are lots of options. There is no cure. And so we want to make sure that physicians have at their disposal the best possible options to treat patients to return them to the quality of life that they'd like to have.
Thank you. Thanks. That's great. Now we have about 20 minutes or so to go through a few questions that we have had from the audience. So the first question is actually for Jess. You guys work in a unique space, working directly with physician and physician groups, as well as obviously the advocacy community. So the audience is interested in what tips would you give to advocacy groups wanting to work with physicians and physician groups? How is this audience different than others that maybe the advocacy community would work with?
Yeah, I would say to just be to reach out and to share the work that you're doing. You know, there's a lot of groups specifically that the Urology Care Foundation works with. So we know a lot of what's going on, but we don't know everything. So I think the best point is to start a conversation and see where our areas align. Because as in with any partnership, if you find advocacy initiatives that you're working on and you both have similar interests and goals, a partnership is a great way to accomplish what you're setting out to do.
Absolutely. Both you as well as Phyllis talked a lot about convening and convening advocacy organizations within this space and that collective voice and how that helps move your mission forward. And so, Phyllis, I'm wondering, kind of what are the challenges there when bringing together differing organizations and viewpoints and stakeholders to the table, and what are the opportunities there as well? So kind of a two-part question there, I guess.
Well, you know, as I said, I've been doing this for many years, and I think one of the challenges is that there are a lot of coalitions and there are a lot of issues. Some of them are broad, like the ACA, that affect a lot of different health concerns. So there are a number of letters going around. There's always a number of letters, particularly with the ACA now, asking organizations to sign on. And so I think there was one letter that had over, 70 organizations sign on that goes to all the members of the Hill. I think one of the complications is that there are so many issues and so many areas of health that need more research funding that it's sometimes difficult because while we all want the best health for everyone, we're all sort of representing, different spectrums of the healthcare community. As I said earlier, ours is more general, but looking at bladder health, for example, I mean, I'm sure one of the things that they look at is getting more funding and attention for some of their issues. I was actually on the board of the Interstitial Cystitis Association for a number of years, and I remember how difficult it was to get people to understand what that was and why it was important to do research in it. So on the one hand, it's good to bring everybody together because the stronger the voice is. On the other hand, everybody does have their own issues also, and so they need to determine how much time and effort they have on as every issue develops.
Right. Yeah, thank you. Definitely a lot of benefits to that, but certainly challenges as well. Jess, could you talk to us a little bit about that from the Bladder Health Alliance perspective? You had mentioned a couple big wins that you've had as a coalition. How has it been working with the larger group, and what other successes have you seen or challenges as well, I guess?
Yeah, I think when we first started the Bladder Health Alliance, it was specifically targeted to overactive bladder. So the mission was much more narrow and what everybody had in common. So I think it was good to broaden our goals and what we were working on so we could invite more partners to help us with our efforts. So yeah, I agree, broadening things is a great way to formulate partnerships and get started. I will say, not every group isn't going to agree on every issue all the time, and that's okay. I think as, Steve had mentioned earlier, just formulating those partnerships and helping each other out when possible, it just creates good relationships overall. And the Bladder Health Alliance, has been really successful. Raising awareness is something that everyone could agree on and could work towards that. Specifically, social media-wise, it's been very impactful to have all of our members participating. And I mentioned the thunderclap that we did earlier. That was something new and innovative that one of our members came up with. So yeah, I think just continuing to invite new members to join is important, and then just continuing to put out communication and being transparent about what the group's working on is important too.
For sure. Thank you. And Steve, you spoke a lot about kind of having those friends in social media and how to get them engaged with the work that you're doing, as well as supporting the work that they're doing on social media, so you can share content and support each other through engagement and enlarging that audience. So I'm curious what you have to add on maybe challenges or successes you've seen specifically in the social media space, and how organizations can take that back to their own groups.
Yeah, I think that all of us, particularly those of us that work in relatively small organizations, are really pressed for time and resources, keeping up. And so when we get a request, we have to move very quickly to try to honor that request, and we will if we can do something that is meaningful in a short period of time. We found that if we're very specific with our requests, and we give folks as much of the material to make it turnkey as possible, then they're willing to do things for us. HealthyWomen has done a number of things with us and for us to push out things for both women's health, recognizing Women's Day, things that are not exactly within the space of incontinence, but recognize that women are really important and their health is really important, which is HealthyWomen's mission. And so they're very responsive for that. And it starts by having a couple friends, and again, be very specific what they ask, and as turnkey as possible. And like most of our organizations, we'd like as much warning as possible. But in social media, it doesn't happen like that. It happens pretty quickly. And so you just have to be open to that dialogue. And you'll find, and I think Jess has said it, that all of us that are part of a coalition have some similar goals and aspects of our mission that overlap. And so it's okay for somebody to tell us no, because I know that there'll be something more appropriate when we ask them the next time.
Yeah, absolutely. So just keep that relationship going and understand the limitations of each organization and what their ultimate mission is. That's great. We have a question from the audience. This group has a pretty small budget as far as marketing and communication goes. So, Steve, could you provide a few tips or tricks for groups that have small budgets but really want to get engaged in social media? Where should they start and what should they do?
I think, as Jenny, you were very nice about my background. One of the things that we spent a lot of time talking about was understand strategically what the role of social media is. Everybody wants to be in social media. The question is, what does success look like to you? And to us, it's about engagement. It's getting our audiences and folks to engage. If you don't actually have time to spend to figure out what your strategic objectives are, then you're most likely going to waste time and money. And your audiences will figure that out pretty quickly. So first, make sure you're clear about what you're trying to accomplish and who you're trying to reach. And secondly, if you start social media, you can't really stop it. If you post something and don't post for another month, those that are engaging with you occasionally will cease to be involved. So it's an ongoing dialogue, which means that you have to have somebody that's willing to look on an ongoing basis, maybe daily, to see what kind of questions, what responses, what pieces are coming in and going out. You don't have to publish every day. You don't have to publish 5 times a day. You don't need to tweet 6 and 7 times a day. You just need to have some form of regular communication that provides new materials. I think those 3 things, watch it, look at it every day, have something of interest for your audience, and know where you're going, are critical to the success, even if you have limited dollars.
Great. Anything else to add from maybe Phyllis or Jess on that topic?
Well, only that obviously everybody knows how important social media is now. I mean, it's the way you get your message across. We have someone obviously that's dedicated to that full time. If you've got a small budget, as I said earlier, I think, and I've done this before, there are small groups that have come to me and asked to work together. And so, what we're able to do is help them and get out the information. Again, since we are interested in all conditions that disproportionately or exclusively affect women, then any small organization that has an issue that is in that category, we could potentially work with them. So they need to, I think one of the good things, I mean, there are a lot of good things about HealthyWomen, but one of the good things is that we're able to address all issues. So let's say, people who are interested in breast cancer or osteoporosis, whatever, are going to go to those websites. Those are the people who usually already have those issues. But what our website does really is look at all the issues and help people also navigate to the websites where they need to get more information from. So, as I said earlier, we are open to work with all and to help as much as we can. Social media obviously has become incredibly important, and really can't do any advocacy or education without.
Great. Thank you. And certainly, HealthyWomen is kind of a powerhouse within the content and communications aspect related to women's health generally. But as you said in your introductory remarks, you guys have made a big change to focus pretty heavily now on advocacy and or on more of the policy side of things. A lot of that has to do certainly with you joining the organization. A couple of questions that have come in for you, Phyllis. Why now? Why make this change now at this time? And also, how can your consumers and that large audience that you've gathered through the HealthyWomen website and materials engage with you on your policy efforts? What steps can they take to support the work that you're doing?
Well, one of the reasons why now is Beth, who is the CEO, apparently was interested in getting more involved in policy and advocacy. As I said earlier, the organization was focused primarily on education and communication, and asked me whether I'd be willing to come over and help establish that. Coincidentally, of course, was the election and everything that's going on with the Affordable Care Act. And so it became sort of imperative that we dive right in. I don't know whether we would have gotten so involved so quickly with so much had so much not been going on in Washington. It was also an opportunity to introduce HealthyWomen to the whole policy and advocacy constituency here. They had been involved to some extent. It wasn't that they had partnerships with other organizations, but most of their work had been online, and they just wanted to expand their reach. And I felt sort of challenging to help them do it, and as I said, because of the time. And as there are so many issues. I mean, obviously the ACA, I keep saying that, but the opiate issue is really major, and that's something we've gotten very involved in. We're going to be doing a program on medication safety. So these issues affect individuals. So people have to realize that the policy what the policy is determines to a large extent what their care is going to be, whether there's money for it, coverage, and whether there's research funding. So it's extremely important. And so it was just just sort of coincidental, I guess, that they decided they wanted to get involved in it, and I had been doing it for a number of years and offered to work with them. Now, what was the second part of that question?
I think you pretty much answered that. Yeah.
Okay. All right. Good.
Thanks. And I guess I'll open it up to both Steven and Jess about how your patients, your members, or your physicians, I guess, in your case, Jessica, on how they can get involved in the work that you're doing and really engage with the organizations and help move your mission forward.
Well, this is Jess. For us and, engaging physicians, we want to make sure that it doesn't create too much extra time or too much of a burden for them, but to also help them realize how important that their voice is. So we do a lot of action alerts where we can produce, a template of some type of letter or just some basic messaging that our physicians can use, and we always tell them to personalize any messaging that we provide to them. But I think if we do a lot of the legwork for them, it's easier for them to share a message with their member of Congress. And then also our physicians are very active on Twitter, so we always tell them to follow us and what we're doing. They were very active during Bladder Health Month and used our specific hashtags. So again, if you just kind of put a clear message out there and make it simple, it's easy for them to get involved.
Great. Thank you. Steve, anything to add to that?
Well, we are mostly a consumer-facing organization. We love our healthcare providers, but mostly what we do with our healthcare providers is help them with the communication on patients. So we don't provide clinical support. We have a physician membership, provider membership, which is fairly inexpensive, and we've got a number of newsletters, a consumer newsletter and a HCP newsletter that's actually pretty widely read and pretty well received. It's called the Continence Connection. Nice name. And so it has ways in there that we invite participation. I think Jess is absolutely correct that when you reach out particularly to healthcare providers with limited amount of time and effort, we try to make it as short, as succinct, and as clear of what we're looking for. And we also oftentimes look for ways that it's not the healthcare provider themselves that's working to support our advocacy efforts, but it's their MPPAs and nurses, folks that actually engage in patients with longer periods of time, given the busy schedules that we physicians have. And then we have very specific social campaigns where we get people involved. So we use Twitter and Facebook a lot to get patients involved with a very specific ask and campaign. And that's worked nicely. we'd like to have more and more people engaged, but again, it's a topic that's really tough for some people to even, they're interested in the treatment options and resources. It's a hard thing to talk about.
Great. Thank you. Well, thank you all for the work that you've been doing. Before we wrap up today, I want to open it up to each of our panelists to just give us maybe 1 minute or so of recap, or maybe things that I missed that you'd like to really share with our audience about your work in advocacy and how we can kind of move the needle forward. Phyllis, I'll start with you, and then we'll go to Jess and Steve.
Well, thank you. Well, obviously, people need to come to our website, www.healthywomen.org. A lot of the information is on there, and we are actually redesigning it to make it a little bit easier. And we'll be linking to a lot of the meetings, advocacy group meetings and coalition meetings that we are attending, so people will know really what's going on in Washington. We still don't know what's going to happen with this tax bill and how that's going to affect the ACA. We need to keep on top of that, and we will be continuing to send out information on that. So I just think women have to realize, and I've said this before, that this just doesn't happen just like that. Things happen because people push them, and I think it's been obvious, certainly since the election, that there's been a lot of political activism, and I think in the area of healthcare, it's particularly needed since clearly it affects everybody. So we all need to be active in this area and make sure that everybody gets the care and the funding that's necessary.
Thank you, Phyllis. I'll turn it over to Jess for a few last comments.
Yeah, I would just encourage people to reach out if there's anything that we can do to partner with advocacy efforts. For anybody interested in the Bladder Health Alliance activities, we're looking forward to another successful 2018 campaign, so I encourage people to get involved in that, mostly by following us on social media, and then just to continue collaboration efforts, which is kind of, I think, one of the main messages that we all received today, and how important it is to let others know what you're working on, because there are power in numbers.
Thank you. And Steve, a few last comments from you?
Well, I was asked to provide more tactical information than Phyllis and Jessica, which is fantastic. We do a pretty nice job with our social media, and I'm sure that there are folks on the phone that do it as well, if not better. But it is an important part of the communication, and I think Phyllis said it correct. It's the way that most of us are going to get our messages out in the future. It is the platform of the future. And so trying to learn how to do the best job you can is worth the time and effort to get it right. Because when it goes badly, your members are more likely to not come back to you for the help and support that you are already dedicated to providing to them. So I hope our comments have been useful and helpful today. And if you would like to collaborate, let me know. We're at nafc.org. And you can reach us, and we'd love to increase the number of friends that we have.
Thank you. Thanks. Well, a big thank you to today's panel. We really appreciate you taking time to work with us on the articles for ChangeTogether.com, and of course, sharing your expertise on the webinar today. We've all learned a lot, certainly. And thank you to everyone that has joined us today. We hope you found it useful. If you'd like to get in touch with any of the panelists or myself, please email the Stakeholder Engagement email address on the slide. And remember, you can watch the recorded webinar at any time or share it with colleagues or friends if you think they would find it useful. Once again, thank you so much for your questions, your engagement, and your attendance today. Thank you for listening, and we hope to see you next time. Have a great day. Bye-bye.
Thanks.
Bye.